like I've mentioned, I really admire you putting yourself out there and working towards this goal of using your expertise to educate on a really important topic. I will share one of the things that inspired me to start using my online presence a little bit more is I actually heard a nutritionist interviewed on a podcast, and she was very candid saying, this is not what I was trained to do. I was not trained to sit across from a reporter or a media person and communicate about my work. And yet I'm here because there is so much misinformation about nutrition science. And I'm here on behalf of my work and the work of my colleagues to share our research and, to sit here as a real person, talk about research that we're proud of and that we believe in. But I'm not a trained communicator. This is not, what I got my training in.
Right.
And so it inspired me to be more bold, on my social media and to offer what I can, to help encourage people to show some resources and to just be vulnerable and show myself kind of fumbling and
Yeah.
being clunky
Yeah.
and um, that it's okay. It's okay to come here without like a perfectly polished, version of yourself. So I'm just curious, have you had this conversation with your colleagues about, folks in the medical profession or with science backgrounds having to turn into much better communicators in a way that you maybe did not plan to when you were getting your medical training?
Yeah, so yes and no. Yeah, so like my colleagues that I'm involved on social media with who are also participating in this platform, we've had those
Hmm.
conversations, where this is just we're just trying to figure it out, trying to fit it into our lives, but we know it's an important space. Another thing to recognize is it's also is met with its challenges in that sometimes it's not met with open arms.
Yep.
Sometimes you are met with those people that come back with uh, a lot of negative comments.
For their own narratives, their
Or their own
own,
narrative. That's right.
ideas. Yeah.
That's right. Thankfully, I haven't seen a whole lot of that personally, but that can weigh you down also as you're trying to do this and as you're trying to put yourself out there. So I think some of the physicians and my colleagues that are involved in this space have felt that almost that burnout of, we're doing this, but why? We're
Hmm.
doing this and is it making a difference? But
Hmm.
the truth is, I really think we are. It's just being consistent with it.
Hmm.
And then, my colleagues that I work with at the clinic, a lot of them, I think a lot of them are probably more in the camp of being intimidated still by it.
Hmm.
But I try to encourage them as much as possible. It's not a hard thing to jump into. And they're all such bright physicians and nurse
Hmm.
practitioners that I work with, that their voice is wonderful. And I encourage them to continue to make their voices heard.